Pain in the buttocks, sacrum, hip, and leg can result from problems with the three gluteal muscles. In the first part of this video, we'll discuss the causes of this pain and therapeutic exercises for restoring the health of the gluteus maximus. In the second part, we'll take a detailed look at how to relieve pain at home from problematic gluteus medius and minimus muscles. I'm Dr. Chernov. Thank you for your like and subscription. Enjoy watching.
The gluteus maximus muscle forms the prominent part of the buttock and is quite a large muscle. It is twice as heavy as the combined weight of the gluteus medius and minimus muscles. At the top, the gluteus maximus muscle attaches to the posterior edge of the ilium, the sacrum, and the coccyx, and at the bottom to the iliotibial tract and the femur. When there are issues with the gluteus maximus muscle, a characteristic gait is observed with reduced load on the affected leg. Difficulties arise with prolonged sitting, especially on a hard surface, and there is a limitation in hip joint flexion. Areas of tension or trigger points in the gluteus maximus muscle are located in three regions. The first trigger point is located near the sacrum and reflects pain in the sacroiliac joint area, along the gluteal fold and into the upper part of the back of the thigh. Sometimes pain may occur in the lower back. The second trigger point is the most common and is located just above the ischial tuberosity. It causes pain across the entire surface of the buttock, as well as deep within it. The pain may spread to the lower parts of the sacrum, as well as laterally, below the iliac crest. When sitting on a hard surface, mechanical compression of this trigger point can cause intense pain, comparable to the sensation of a nail being driven into the bone. The third trigger point, located in the lower inner part of the gluteus maximus muscle, causes intense soreness in the coccyx area, especially when sitting on a hard surface. Pain originating from the trigger points of the gluteus maximus muscle intensifies during sudden muscle contraction, such as during uphill climbing or stair climbing, during running, or while swimming. Such cramp-like pain most often occurs in cold water. Trigger points in the gluteus maximus muscle are often activated by sudden stress, such as during a fall or loss of balance, especially when the muscle undergoes a rapid contraction in an attempt to prevent the fall. A bruise to the gluteal muscle from falling backward or the injection of medications into the muscle can also activate trigger points and trigger pain sensations. Sleeping on your side with the top leg sharply bent can lead to stretching of the gluteus maximus muscle and the onset of pain. Prolonged sitting, especially when a person is partially reclining backward with straightened knees, is also highly undesirable and can cause compression of trigger points and restricted blood flow in the muscle. A forward head position with thoracic kyphosis while standing, which increases flexion in the hip joints, also causes overloading of the gluteus maximus muscle. Another common cause of the development and activation of trigger points in the gluteus maximus muscle, leading to pain in the gluteal region and lower back, is carrying a smartphone or wallet in the back pocket of pants, especially when sitting, as the wallet presses on the muscle for an extended period. You can independently get rid of trigger points in the gluteus maximus muscle through intensive mechanical impact followed by stretching of the muscle. You can apply mechanical impact on the trigger points using a large massage roller. Sit on the floor, bend your legs at the knees, and place the massage roller under the area of the gluteal muscles. Perform slow movements with your pelvis forward and backward. Look for the most tense and painful areas of the muscle. Once you find such an area, pause on it for 30 to 60 seconds, and then continue moving your pelvis forward and backward. You can intensify the mechanical impact on the right and left gluteus maximus muscle by shifting your center of gravity to the side. Support yourself on your feet in one hand, and roll the muscle for a few minutes. Then repeat the exercise on the other side. You can further intensify the mechanical impact by placing one leg over the thigh of the other leg. After that, take a small massage ball and place it under the right gluteus maximus muscle. Move your pelvis forward and backward, right and left, clockwise and counterclockwise. Pause on painful areas of the muscle for 30 to 60 seconds, and then continue with slow massage movements. Then place the massage ball under the left gluteus muscle and repeat the exercise. A more complex, yet even more effective version of this exercise is when one leg is on the thigh of the other leg. In this case, intense mechanical impact can also be applied to the deeper located piriformis muscle. Be sure to repeat the exercise on the other side. If the previous exercise was difficult for you, try the simplest version of working with the massage ball while lying on your back. Bend both legs at the knee joints, lift the pelvis, place the ball under the area of the right gluteus maximus muscle, and straighten the right leg. Apply massage pressure to the muscle for a few minutes, and then repeat the exercise on the other side. After performing any of the myofascial release techniques described above, proceed to stretch the gluteus maximus muscle. The gluteus maximus muscle, when the torso is fixed, extends the leg at the hip joint, and when the legs are fixed, it rotates the pelvis backward, participating in the flexion of the spine, as well as performing a number of other functions. Therefore, to stretch it, you need to perform exercises that involve flexing the hip at the hip joint with a fixed pelvis, or anterior pelvic tilt with a fixed thigh. The simplest exercise for stretching the gluteus maximus muscle is the lying position. Bend one leg at the hip and knee joints and grasp the thigh with your hands. Bring the leg closer to the body and hold the final position for 1 to 3 minutes, maintaining deep breathing and gradually increasing the stretch of the muscle. This exercise can be combined with the post-isometric relaxation technique. To do this, inhale and tense the gluteus maximus and the muscles at the back of the thigh, resisting with your hands. Then with a slow exhale through the mouth, completely relax the leg muscles and move the thigh towards the body. Repeat this sequence of actions several times and be sure to perform the exercise on the other leg. Another simple exercise for stretching the gluteus maximus is as follows. Take a chair and place the foot of one leg on the seat of the chair. Grab the backrest with your hands and tilt your pelvis and torso forward. Hold the final position for 1 to 3 minutes, maintaining calm and deep breathing, and then perform the exercise on the other side. You can also stretch both gluteus maximus muscles simultaneously while sitting on a chair. Place your feet wide apart and lean forward. Lower your hands between your legs and relax your neck. To achieve a more intense stretch of the gluteus maximus muscles, sit on the floor with your legs straight. Grab your shins or feet with your hands and lean your torso forward as you exhale. Hold the final position for 1 to 3 minutes, maintaining deep breathing and feeling the stretch in the muscles. This same exercise can be performed while standing. Bend your torso towards your straight legs and try to completely relax your neck. Use your hands to help bring your torso closer to your legs. There are also a number of more advanced exercises that stretch the gluteus maximus muscle even more intensely, but they require prior preparation and careful practice. After completing all the stretching exercises, it is necessary to perform several smooth, active movements that engage the gluteus maximus muscle. For example, you can stand by the wall and bend and straighten your leg at the hip joint several times. If you have the aforementioned issues with the gluteus maximus muscle, limit the duration of sitting. For example, if you need to work at the computer for a long time, set a timer for 15 to 20 minutes and place your smartphone at the other end of the room. This will help you combat prolonged static load on the muscle and encourage periodic stretching. While sitting, it is necessary to maintain proper posture, avoiding a forward head position and rounded shoulders. It is important to use a soft orthopedic cushion, especially if your chair has a hard surface. If you are accustomed to sleeping on your back, place a roller or a small pillow under your knees to prevent prolonged shortening of the gluteus maximus muscle. If you sleep on your side, place a pillow between your legs. When getting up from a chair or climbing stairs, place one hand on your hip to reduce the strain on the muscle. It is important to note that the gluteus maximus muscle significantly contributes to maintaining an upright posture and is actively engaged during walking. But if you have improper foot placement with predominant external rotation of the foot, then during the extension of the leg at the hip joint, the gluteus medius and minimus muscles are engaged instead of the gluteus maximus. This can lead to insufficient training of the gluteus maximus and overloading of the gluteus medius and minimus, resulting in a specific pain pattern.
The gluteus medius and minimus are two small muscles in the human body that play a crucial role in pelvic elevation and maintaining an upright position. The gluteus minimus attaches to the outer surface of the ilium at the top and to the greater trochanter of the femur at the bottom. The gluteus medius is approximately twice as large, located above the gluteus minimus and attaching in the same locations, but at a greater distance. Both of these muscles are located under the gluteus maximus. Despite their small size, the gluteus medius and minimus muscles can cause significant problems, causing pain in the lower back, buttocks, hip joints, and legs. Specific areas of tension or trigger points located in the anterior portion of the gluteus medius refer pain along the iliac crest, lower spine, and on the corresponding side along the sacrum. Trigger points located in the medial portion of the muscle cause pain in the buttock and upper outer thigh. Trigger points located in the posterior portion of the muscle refer pain to the lower back along the iliac crest, iliosacral joint, and buttock. Trigger points located in the anterior portion of the gluteus minimus muscle cause pain in the lower outer quadrant of the buttock, outer thigh, knee, and lower leg. Trigger points located in the posterior portion of the gluteus minimus muscle cause pain in the buttock, particularly in the lower inner quadrant, as well as in the posterior thigh, knee, and lower leg. Pain from trigger points in the gluteus medius and minimus can be persistent and excruciating. It intensifies when rising from a deep chair, straightening the torso, walking and standing for long periods. Hip pain causes limping, resulting in a characteristic gait in which the person avoids putting weight on the affected leg and sometimes even prefers to use a cane to relieve the strain on the affected muscles. Carrying a heavy object in one hand or carrying a child, an injury, a sudden fall, prolonged or fast walking, especially on uneven surfaces or intense running, tennis, hockey, soccer, and other sports can severely strain the gluteal muscles and cause characteristic pain. Lying on the affected side can cause such intense pain that turning onto that side during sleep can wake the person up. Being overweight or being pregnant in late pregnancy often causes lower back and hip pain. Excessive hip flexion while sleeping on the side in the fetal position or excessive forward lean while sitting can also cause pain. Compression of the gluteal muscles, decreased blood flow, and activation of trigger points can be caused by prolonged sitting with a wallet or other bulky item in the back pocket of your trousers. Perform 2 tests to determine the condition of your gluteus minimus and medius muscles. Lie on your left side and bend your right leg at 90 degrees at the hip. If your muscles are healthy, your knee will touch the floor. If your knee is slightly above the floor, this indicates limited hip adduction, which may be caused by tight gluteus medius and minimus. Roll onto your right side, repeat the test on the other side, and compare the results. Perform the second test. Sit in a chair and try to slowly cross your right leg over your left, then repeat the test on the other side. If you have a problem with your gluteus minimus and medius, you will either be unable to cross one leg over the other or will experience increased pain, typical of these muscles. Since the gluteus medius and minimus perform the same functions and are located in the same location, the differences between these two muscles are not very significant from a treatment perspective. To relieve pain and trigger points at home, you need to apply mechanical force to the muscles and then do stretching exercises. Use a large massage foam roller or a 2-liter bottle filled with warm water. Lie down on the floor and massage the area of the right gluteus medius and minimus from the iliac crest to the greater trochanter of the femur for several minutes. Move slowly back and forth along the muscle fibers, breathe smoothly through your nose, and try to relax the muscles as much as possible. Turn to the other side and slowly massage the opposite side for several minutes. Next, take a tennis ball or special massage balls with a diameter of 8 or 12 centimeters and again massage the gluteus medius and the gluteus minimus underneath, paying particular attention to the characteristic trigger point areas. If you find a tight or painful area of the muscle, stop and apply pressure to it for 15-30 seconds, then massage the muscle again. Be sure to repeat this exercise on the other side. It's more comfortable to work the gluteus medius and minimus while lying on the floor on a large massage ball. However, if this exercise causes you unbearable pain, do the same exercise against a wall, adjusting the intensity of the massage. You can also enlist the help of a massage therapist or a friend. Lie on your side and place a pillow between your legs. Bend your top leg slightly at the hip. Ask a person nearby to massage first the right, then the left gluteus medius and minimus muscles with their thumbs for several minutes, pausing for 15 to 30 seconds over the trigger point area. To significantly intensify the pressure on the trigger points, you can use your elbow. Start by applying gentle pressure with your elbow, then gradually increase the intensity. Afterward, be sure to stretch. The primary function of the gluteus medius and minimus, in addition to pelvic stabilization, is hip abduction. The anterior and posterior fibers of these muscles also contribute to internal and external rotation of the thigh at the hip joint. Therefore, to stretch these muscles, you need to adduct the hip. Lie on your left side on a table or couch. Place a blanket or small pillow under your pelvis. First, tense your right gluteus medius and minimus for 5 seconds by lifting your right leg up, or try lifting your right leg up while applying downward pressure with your left heel. Then relax and allow your right leg to lower. To intensify the stretch, you can apply additional pressure with your left foot. Hold the final position for 1 minute, breathing smoothly and deeply through your nose. This exercise stretches the anterior and central fibers of the gluteus medius and minimus. To further stretch the posterior fibers of the glutes, move closer to the front edge of a table or couch, lift your right leg up for 5 seconds, and then lower your right leg back down, holding the final position for 1 minute. After performing 2 to 3 repetitions of this exercise, be sure to turn onto your other side and stretch your left gluteus minimus and medius. A similar exercise can be performed standing against a wall. Leaning your hands against the wall, extend your right leg back and to the left. Bending your left leg and lowering your pelvis, stretch your right gluteus medius and minimus for 1 minute. Then repeat this exercise on the other side. You can also hold a chair, grasp the back of the chair with your hands, and place your right foot on the seat. Press your right knee with your right hand and slowly lower your right thigh down. Hold the final position for 1 minute. Slowly return to the starting position and repeat the exercise on your left leg. You can stretch your glutes while sitting on the floor. Bend your right knee and place your right foot behind your left knee. Grasp your right knee or thigh with your left hand. Rotate your torso to the right and strongly adduct your right thigh. After holding this position for a minute, repeat the exercise on the other side. A similar exercise can be performed lying on your back. Yoga also offers a number of more challenging yet even more effective exercises that intensely stretch the gluteus minimus and medius muscles, such as Kapotasana, Pigeon Pose, Garudasana, Eagle Pose, Agni Stambhasana, and Vatayanasana. However, all of these require extensive preparation. After completing any of the stretching exercises described above, it's important to engage your gluteal muscles. To do this, perform several cycles of active movements, adducting and abducting your leg. A wonderful addition to completing the entire gluteus medius and minimus workout is warming the gluteal area with a hot, moist compress. When driving, the right foot is almost always on the accelerator pedal, which leads to constant tension in the right gluteal muscles. Use cruise control whenever possible and change your foot position frequently. If you're traveling long distances, take breaks every 200 and 300 kilometers to stretch your muscles. If you spend a lot of time sitting at a computer, get up every 15-20 minutes, walk around the room, or do exercises that improve blood flow to the gluteal muscles or stretch. Before injecting any medications into the gluteal muscles, it's essential to examine them for trigger points, as intramuscular injection of some medications can activate trigger points and cause rapid pain. Trigger points in the Quadratus lumborum can cause trigger points in the gluteus medius and minimus. I highly recommend watching the video about this muscle, as well as the videos about other muscles in the pain relief playlist. If you enjoyed this video, I'd be happy if you'd give it a like or comment and share it with your friends who suffer from lower back, buttock, and leg pain. Stay healthy and see you in the next videos.